working really hard for their money.
Exactly.
Not like 50 years ago
No.
when,
Yeah,
you know,
it
you
was
could work 3 days, 4 days a
Yeah,
week.
yeah.
But now, question always comes up on contacts.
Yes.
Somebody comes in, and I've never had contacts. I was always told I don't have the patience for them. But how do you decide? Do I get glasses? Do I get contacts? And then, of course, if I'm getting contacts, I mean, I saw this whole thing about these knockoffs you buy on the internet for 2 cents a piece that weren't quite sterile and weren't. But let's start with to contact or not to contact.
Well, it depends on the motivation. If it's a young teenager that wants to get out of his or her glasses, simple, rather straightforward prescription, go for it. Then when you get older, in your 40s or 50s, if you want to avoid reading glasses or bifocals, then it becomes a little bit more tricky getting fit successfully. And then if you have, and you're in the cataract age in 70s and 80s, most people aren't interested in fiddling around with a contact lens. So they're certainly popular. They've been popular, of course, for generations. The technology keeps advancing, and with the advent of LASIK surgery, that's taken a cut into the contact lens portion of the population. People that previously were wearing or might have considered wearing contacts now are having laser surgery. But it's still got a certain niche there, and I still enjoy fitting them. I enjoy dealing with I enjoy treating the complications when they come up, and it's part of the whole package of treating patients. But again, we don't particularly care where patients buy their contacts, but they have to follow the hygiene rules. We don't want them, overwearing them or certainly buying stuff off.
Well, you have now. My daughter got them
Yes.
to wear once a day,
Yes,
once a week,
sure.
Tuesdays, but not
Yeah,
on a
yeah,
Buddhist
yep.
holiday.
Yeah,
I mean, I
yeah,
can't figure out the rules.
It depends on the style, and you've just got to understand it. Of course, the most hygienic, theoretically, would be the daily disposables. You wear them, throw them out, wear them, throw them out. So there's no germs that can build up. Then you got your 2 weeks or your monthly disposables, your 3 months disposables, your annual ones that don't
Wait a minute,
dispose.
you'd have contacts in for a month?
No,
take
well,
them
you
out?
can. I mean, some of them are approved by the FDA for overnight use for that long. In my experience, my practice, we never allow, or if you will, or
advise recommend.
over any overnight use. It just creates a high risk of infection.
You're still better off taking them out and washing them
yes,
every night.
yep, yep.
But now, if I buy my lenses through my eye care professional, I got a better, at least in my mind, I would expect that you're not going to sell me who contacts.
Well, that's absolutely right. Thank you for saying that, because what we do at my practice, and it's all I can speak to, is to deal with that issue so we always know what brand the patient's wearing and what strength and curvatures when they're being replaced. We just basically sell them at a minimal to no profit because we can computerize the delivery of the lenses. So if the patient's traveling somewhere or they lose one somewhere, we know immediately what they're wearing. Or if they skip a few visits, they come back a year later, 2 years later, we know exactly what they were wearing when they lost it or what the problem is. We don't really care per se where patients buy them, but we realize at a higher level that there's a benefit to having everything centralized. So we try to.
Well, I mean, I can see why you don't care, because you're not making a lot of money on
Exactly.
it. So
Yep.
But from a patient point of view, do I really save that much going on the internet?
Not with my practice, you don't.
Okay.
Because,
so realistically, if I'm paying a little tiny premium to know that you're watching out for me,
Yes. Yeah.
I can understand that. It's
yeah.
not double the price or anything.
Oh no. And no.
Now, Halloween comes, and I see all the issues of kids
Yes.
who go on and buy, and I don't want to pick on the Far East, Chinese contacts that change your eyes to orange.
Oh yeah.
And then you find out the reason they're sold at novelty stores for 2 cents or $1 a piece is that's what they're worth, and they're not quite sterile.
Yeah.
I mean, that would scare the heck out of me to take something
absolutely.
that isn't at an FDA level
Of
and
course.
stick it. I mean, it's not like it's bad enough if I wear a ring and I turn
sure.
my
Yeah.
finger brown
Yeah.
or green, whatever.
Yeah.
But On a mucous membrane?
That's exactly right. So they're reputable companies in the United States that make regular contacts, make the novelty contacts.
Oh, they do.
And they're manufactured to the same high standards. So that's always fun. Given.
So again,
yeah.
if I want to go crazy and
Yeah.
have blue, purple,
Sure.
I mean Portuguese
Yeah.
with blue eyes,
Yeah.
that would be a new thing.
Yeah.
But I could go to my eye care
Absolutely.
and say,
you should do it
Dr.
that way.
Goodman,
Yeah.
I want blue eyes
Right,
for the week.
just for the night or the week or whatever. Absolutely. Or you want the bowling balls or whatever.
the
it is.
weird stuff.
Yeah,
but
yeah.
I don't have to try and, because when I saw these articles,
No,
there are kids who are permanently putting their
absolutely.
eyesight at risk.
Well, it's very sad. I mean, you have no idea. I mean, some of the infections that can be into contacts can persist for months and require corneal transplant surgery.
Oh, Lord.
Absolutely. Yes. Yep.
So besides the three that we've hit,
Yeah.
what would be the thing that keeps you the busiest on the other side, not the surgery?
On the medical side, I would say, well, of course, the three that we mentioned,